Good afternoon. It's my pleasure to introduce the distinguished speakers on this panel, focusing on the security dimensions of the Women, Peace and Security agenda. I would like to first introduce Jennifer Wittwer here at the end. She's a native Australian and a senior maritime logistics officer and strategic human resource specialist for the Australian Defence Force, and she has nearly 37 years' experience. She has considerable experience in implementing women, peace, and security agenda in the military environment. Since 2012, Jennifer has worked with NATO on the annual Committee on Gender Perspectives and was the coordinator for the NATO research project examining the implementation of UN Security Council 1325, as well as women's participations in the armed forces. She was deployed as the gender advisor to the International Security Assistance Force in Afghanistan, and upon her return to Australia later that year, she was appointed to implement Australia's government National Action Plan for Women, Peace and Security. Earlier this year, Jennifer joined the UN Women in New York on attachment from the ADF. Welcome, Jennifer. I would also like to introduce Dr. Aysha Al-Dhaheri, here on my right. Okay. Dr. Aysha is currently the Deputy Commander of the Armed Forces Medical Corps for the UAE. She was a group leader for the first female military service team to participate in the international humanitarian mission during the war in Kosovo in 1991. Her long-standing interest in delivering medical services and empowering women during the wartime led to her being the first female military physician to be deployed to Afghanistan. Furthermore, she was instrumental in establishing the US-UAE joint polyclinics in Helmand province, providing care and a place to empower Afghani women. In May 2015, Dr. Aysha was sent to Aden to restore and upgrade the health system to support the injured and empower educated Yemenis to restore peace and prosperity. She helps ensure continuous medical support is in Yemen by partnering with the WHO and the MOH, UAE. Welcome to Dr. Aysha. Okay. Daniel de Torres is the Assistant Director and the head of the Gender and Security Division for the Geneva Center for the Democratic Control of the Armed Forces. He's a native of Spain and has enjoyed a varied professional career, including emergency relief work during the war in Bosnia, an embassy posting to Washington, D.C., and as well as service in the Spanish Marines. He has over 10 years of work on gender and security. He has developed and managed field projects, designed and delivered training for military and police personnel, prosecutors, judges, parliamentarians, development professionals, civil society organizations, as well as providing policy advice and analysis. Welcome to Daniel. And last but not least, we have IreneFellin here. Irene is the president of WIIS in Italy and the coordinator of the Mediterranean Women's Mediators Network. She served as the advisor to NATO's Secretary General Special Representative for Women, Peace and Security from 2013 to 2014. She was in charge of providing advice to NATO staff on WPS-related issues and of giving training to international officials and assisting the Alliance on the implementation of the policy and action plan for 1325. In Rome, where she's currently based, she's a member of the local civil society engaged on promoting the role of women in politics, defense and security issues, and on raising awareness on the important role that Italian women can play in international security. She's an associate fellow at the Institute for International Affairs in Rome and a trainer on gender, peace and security issues at the Center of Excellence for Police Stability. So it's my great pleasure to be chairing this panel today. With so much experience, I'm sure we'll have a very stimulating conversation. I would like to kick off with you, Daniel. So you are the gender leader at DCAF, okay, which is an interesting organization. It was established in the year 2000, just after the Cold War ended, and the idea was to bring militaries under civilian control, and also an interesting organization for having realized early on the importance of incorporating gender into security matters. So with that in mind, I would just like you to highlight how DCAF started to pay attention to gender when dealing with the military and the security sector. And if you can, give us some examples of what it means in practice to integrate gender into security, military, and peacekeeping operations, and whether or not you feel that there's an important role for training in there.
Thank you. That's an excellent question. So DCAF was founded initially with the idea to help with the reform of particularly the military, but also the police and the intelligence services of former communist countries after the end of the Cold War. And then it saw its mission expand to other locations in the world and to expand also thematically. Now, early on in DCAF's mandate, we realized, well, they realized, that was before I joined, but so DCAF realized that if the goal is to create security institutions that are able to understand and serve the security needs of the population, that if the goal is to have institutions that are accountable to the citizens that they serve, you have to include the whole citizenship, the whole citizenry. You cannot just exclude 50% of it. So it came as a very logical development, in principle, not out of a principled stand towards gender equality, but as a very practical approach to achieving our goal and perform our mission. So that was a little bit the origin. As we developed the Gender and Security Program and eventually became a Gender and Security Division, a fairly nice-sized team of people exclusively devoted to gender and security, the more we looked into it, the more we saw how this dual vision of, on the one hand, the moral imperative of serving everybody's security needs, and on the other hand, the very practical imperative of this is how you do security properly, they overlap very nicely. So we don't really have to choose in between one explanation on the other. Both of them, the principled and the practical, are very applicable. In terms of security, peacekeeping operations and the stability missions, it's very much the same approach in that, on the one hand, the missions have mandates to protect the population. They have mandates to create peace, security, and stability, and you cannot do that if you have a focus that is too narrow. You cannot do that if you don't have a broad understanding of the security needs and priorities of the whole population. So on the one hand, there's this moral mandate or moral imperative, if you will, and on the other hand, there's the practical approach that this is actually necessary in order to fulfill your mission.
Thank you very much. I would like to transition to you, Irene. So before your current position working for WIIS in Italy, you were working for NATO, and I have a multi-point question for you. So I'm wondering if you can tell us about your experience with WPS in terms of NATO operations, the gender perspectives on NATO operations, and whether or not it's true that in some cases the military is more easily convinced about the necessity and the utility of gender in terms of incorporating it into their military operations. If you found that to be true in your experience.
Yes, thank you. So I joined NATO when the Office of the Special Representative for Women, Peace and Security was established at the end of 2012. This position at that time was not a permanent position. It was a proposal that Norway made at the summit that year to appoint, to second one of the diplomats to create this position. So this is how it happened, and the office was created, and I joined as an advisor. The office was created from nothing, but it has as a support a policy on women, peace and security that NATO had already adopted in 2007, followed by an action plan on implementing women, peace and security into operation only. So there was a difference between the policy that was supposed to cover the cross-cutting issue at NATO and the operational aspect that were focusing only on the operations. It was very challenging to make all the alliance understanding that the women, peace and security agenda is a cross-cutting issue that not always affects the operations. But on the other side, as you said, it's more easy to have the military understanding this aspect because it is more effective. The military see the effectiveness of having the gender perspective included, whereas on the political level, it's sometimes more difficult to see the advantage. And what is for us very challenging as well was to make everybody, allies, but the secretariat at the same time, to understand that we didn't talk only about women's issues. It was already mentioned today several times, but so we were supported when we were making a specific actions, so developing revising the policy or adopting new documents on the specific agenda. But we encountered a lot of difficulties and challenges when we asked our colleagues to include a gender perspective in all their documents and policies. So there was a clear difference on supporting us doing something specific and dedicated for women, what it was considered for women, and not include the gender perspective. So we spend a lot of time working on this and try to have a gender task force working everywhere within the Alliance, in collaboration with the gender advisor on the field, because this was the other dimension. So when we created the office, there were the first gender advisor where I had been deployed in the missions, both in Afghanistan and in Kosovo. But this was the beginning, and it was still very difficult to have feedbacks from the field, to go through the chain of command. And what the first gender advisor experienced was a lack of training, and this is why it was then established all a mechanism for training the gender advisor, but not only them. The problem is that when you train only the gender advisor, they feel then they are disconnected from the commander and all their colleagues, so they don't speak the same language. So it's very important when you train, you have to train both the gender advisor on one side, because this is a profession, so you need to develop skills and have competences. But at the same time, it's relevant that everybody on the field, when we talk about an operation, but also within an organization, that everybody knows the basic language of what the gender principles are. Otherwise, people will not be able to communicate in the same way to understand the objective of a gender policy.
Okay, and just one additional question. Did you find in your experience that there was any difference between NATO countries themselves and NATO partners in this perspective?
Yeah, I can say there are differences, but not between allies and partners as such, but between different countries because of their culture. So we can say that we have a lot of NATO partners that are more committed to this agenda than some allies are. And this is very much linked to the leadership, the role of leadership. Unfortunately, I have to say that at a global level, this agenda is not still institutionalized as it should be. Sometimes we have countries committed on the paper, but then when it comes to actions and real commitment, where we need to translate this into actions, it's very much linked to the representative, so the leader. So if at a given moment you have a person, a permanent representative, that it's very much committed, you will see the difference in their action within the alliance, and vice versa. So the difference is between individuals more than the role within the alliance.
Okay, thank you very much. I just wanted to ask if you had anything to add, Jennifer, because you were the gender advisor for NATO's Women, Peace and Security in the ISAF mission, and if you had any additional comments or you'd like to add.
Yeah, thank you, Leah, for an opportunity just to provide perhaps a practitioner's experience in operations. ISAF, as you know, the International Security Assistance Force, which ceased at the end of 2014, was there to support kinetic operations against insurgents, but also to do capacity development for the Afghan National Security Forces, and in particular, looking at the recruitment, training and development of women. And yet when I arrived there in January 2013, it was very clear to me that no gender perspective was being applied to any of the activities that were being undertaken in collaboration with the Afghan forces, despite this being a prime example of where gender perspective should be considered. So there really were quite a number of challenges in implementing NATO's policy on gender perspective and women, peace and security. And there was a big reliance by ISAF itself on the gender advisor, a responsibility on the gender advisor for implementing gender perspective, rather than actually putting the responsibility back on the command leadership structure of ISAF. And so there was no responsibility or accountability by that senior leadership team at the time. There hadn't been a gender advisor for the previous 12 months before I got there, and the whole command structure had changed out. So essentially we had an organisation at the operational level that had no understanding of 1325 or women, peace and security, or how gender perspective should practically be applied at the operational level. There was this perceived need to prioritise between gender and other issues, other pressing issues during conflict, and a colleague of mine who's been a gender advisor under Resolute Support Mission often quotes a male colonel who said to her one day, "I'm too busy fighting the war to worry about gender." but I actually think that you need to think about gender in order to win the war. There's also confusion about gender issues with women's issues, and this has been touched on by quite a few of the previous speakers. But to the extent where now, and I'm finding amongst many NATO countries as well as partner countries, that we're tending to lean towards the concept of gender in military operations, as opposed to talking about implementing women, peace and security, or the broader women, peace and security agenda within the operational context. So we are focusing on really how gender plays out in how we design, plan and execute our operations and how it impacts the local population. There was also attitudes about the gender advisor profession and gender in general, and this was quite prevalent amongst the males in the ISAF organisation, who felt that it was the gender advisor's job to look after women's issues rather than actually see that gender and gender perspective was everybody's responsibility. There was a lack of knowledge or understanding about 1325 just generally amongst the personnel, despite gender being included as an annex in the commander's plan and operational plans as per NATO policy. There was no understanding of the role of the gender advisor or where that gender advisor should sit in the organisation. So, for example, the position was sitting in the civil military team in plans, when in fact it should have been working for the commander and sitting in the commander's stuff so it could advise across all lines of effort. There was no strategic framework in place to actually integrate gender perspective into the planning and execution of operations. There was a lack of gender analysis in intelligence and also the assessment of any programs that were being created to support the Afghan security forces. And certainly a failure to include gender perspective in any of the operational planning products that were being developed. But there were some successes along the way, which came from perseverance by myself and other gender advisors in ISAF. And it showed to me that actually the implementation of gender perspective, often in a military context, comes down to the passion and enthusiasm of the people who are responsible for implementing it. So certainly the senior leadership was actually a very important aspect of this, and influencing the senior leaders of the operations and plans area was a really important element of the success in getting gender perspective included into operations. Very quickly, there were other efforts to ensure that operational documentation was updated to include gender perspective, and also making sure that any operational products that had to go out of the command actually went through the gender advisor to ensure that there was a consideration of gender perspective. There were lots of other things that were done that made it very successful towards the end, and I think that these have been carried forward into Resolute Support Mission, and I'm sure in other operations and certainly in peacekeeping context. But one thing I would reiterate is that leadership was key to getting some changes in how gender perspective was implemented, and talking about it as a gender issue rather than the women, peace and security agenda, I think really helped.
Okay, thank you very much. Daniel, you've also done some work with NATO in the past, and I'm just wondering on the subject of leadership and the importance of having that present. Do you have anything to add? Any additional comments?
Yeah, absolutely. Leadership is crucial, particularly when you're talking about strongly hierarchical organizations such as the military or the police or other security forces. But I think the role of leadership is not just to be cheerleader and say, yeah, this sounds great, so let's go ahead and do it. It requires certain intellectual leadership. Applying a gender perspective to the work that we do requires some changes, some changes that need to have institutional support, need to have resources. That's where the role of leadership comes in. Particularly following up on Jennifer's remarks, I think that we've a little bit oversold the message that gender is a tool to carry on your operations, when actually gender is a tool to rethink your operations. It's a tool, or rather a framework, to think, again, what we're doing and why, rather than just do business as usual with a little touch of gender perspective.
Thank you very much. Just a final comment on NATO and leadership. I wanted to mention that the UAE is, of course, a NATO country, and they've recently updated their action plan for the Euro-Atlantic Partnership in conjunction with NATO from 2016 to 2018. And in this plan, it highlights what these states and partners can do in the form of leadership in terms of mainstreaming gender perspectives and policies into activities and efforts to prevent and resolve conflicts. This includes appreciating the different risks and security needs of men and women, as well as the contributions to conflict prevention and resolution. So with this in mind, I want to turn to Dr. Aysha here, who is the Deputy Commander of the Medical Services Corps and also a physician. So I wanted to ask you about the participation of women in the armed services in the UAE in particular, and I'll get to some of the specific experiences that you have in countries later on in the panel. But for now, I would like to ask you in general if you have some examples of the UAE services successes integrating gender perspectives, and whether you can highlight the UAE's strengths and achievements on women in the context of women and the safeguarding of women.
Okay, thank you, Leah. The UAE, actually, military did incorporate women in almost all the fields or units. Of course, maybe, we have an advantage in the medical field that it's easier to actually include the women into the military services because we are, highly trained professionals. And, when we join actually the services, we'll be at an age that we have the maturity to be able to actually, participate effectively. But this does not mean actually that it's only medical teams or professionals that they are included in the military. It started with the military, with the medicals, but actually we have engineers, we have pilots now. So we have almost all the occupations, let's say. Also, as medicals, we did have the advantage to participate in the operations internationally before the other actually professions. This is also attributed to the nature of our profession, and definitely the medical is always needed, especially when you come to the conflicts. There is always refugees, and mostly the refugees will be actually women, children, and the elderly. I think by experience, people came to realize that actually females medical teams are more capable, or to actually kind of cater for the needs of those groups. Also, as medical professionals, we have also the advantage of reaching and talking with the refugees and with the people. Let's say not only the refugees, people in conflict, because also we treat injured people, whether they are civilian or military personnel. So we have the advantage to spend the time and influence some of also their thoughts, especially if they are hospitalized in our facilities.
Thank you very much. And thank you for highlighting the role of female medical teams. I think that this is a really important contribution to the women, peace and security in conflict zones. Speaking of conflict zones, I'd like to return to Jennifer and look at the role of peacekeeping and the UN's role there. So for you, I would like to ask you, what are some of the structural and the systemic challenges, as well as the solutions, that female military and police officers often face, both in the pre-selection processes, but also the nomination phases for peacekeeping? If you have any comments, that would be much appreciated.
We know that women's participation in UN peacekeeping is extremely low and has been for the last 10 to 20 years. It's now sitting at around 3% of female military officers and 10% of female police officers, and about 7.5% of female military observers or staff officers. And so there's been a number of studies and surveys that have been conducted by the UN over the last few years to determine what are some other structural barriers to women nominating to deploy or actually even being selected for deployments. Now some of those barriers are actually put in place by national institutions over and above the criteria that's required by the UN. We know that, for example, that information about opportunities to deploy are often not advertised broadly within the military or the police forces. They're kept to very select groups and communities within those organisations, so women are not even often aware that these opportunities exist. Sometimes national institutions impose additional criteria. For example, they might increase the length of service experience that's required, or they might increase the rank level that's required, which is over and above the UN requirements. There can also be some discriminatory recruitment criteria and procedures against women for nominations, for example, where there might be unequal opportunities for women in the national institutions. We also encountered negative social and cultural norms about women seeking to serve in peace operations, as well as lack of up-to-date skills in basic proficiencies such as firearms or English or French or driving skills. Also, the lack of appropriate female role models is really important. There's very few women in leadership positions in UN peacekeeping, and if you can't see it, you often don't strive for it. And I think we underestimate the value of ensuring for women, particularly where we're trying to increase numbers, that there needs to be more role models and more women in senior leadership positions. Now, when we're talking about how to actually address some of those structural barriers, I go back to the issue of leadership that Daniel also spoke about. When you talk about gender balance to generally a male senior leadership in your organisation, it's very important to actually highlight that it's a critical factor to operational effectiveness and the credibility of missions. And I find that if you talk about operational effect or operational impact to male military officers, they actually kind of listen. If you start talking about gender balance or gender parity or gender equality, sometimes their eyes glaze over and as was mentioned in the previous panel, they switch off. Also, too, when we talk about the percentage of women deploying, obviously we're looking to make some increases in the numbers for UN peacekeeping, but it's important to keep in mind that perhaps a general rule of thumb is that the number of women deployed should be at least commensurate with the participation rates in national institutions. We know that generally, particularly for NATO countries, for example, those participation rates are anywhere between 0.9% and 20%, but most erring and averaging around 10%, so that's quite low. So we can't send women if we don't have women. So that sort of brings me to the point that it's very important to do what I call some of the back-end stuff to actually enable the increase of women in peacekeeping. You actually have to enable the increase of women in institutions. So there are a lot of things that can be done to enable that. For example, female-only recruitment. So we talk about actually just specifically targeting women for maybe previously male-dominated professions, military occupations, or more technical occupations. That we do training and capacity development, promotion initiatives and retention strategies. For example, making sure that when we look to promote people, that we ensure that there are more women in the pool from which we might select those people for promotion. So we actually enable women to put themselves in a position where they can be nominated to deploy. Also, the conduct of gender impact assessments and the development of gender equality strategies are very important parts of the participation element of 1325 and will, of course, normally be included in national action plans. And also the review of leadership pipelines for women. So we have to look at how we can enhance women's ability to move more quickly into senior leadership positions than they are. But one thing I would say about increasing numbers and tackling these structural barriers is that it's not just about numbers. We need to actually make sure that we are deploying the right women to do the right jobs and making sure that they are in positions of influence and ability to change and make decisions and certainly influence the gender aspect. I guess I'd also just like to touch on training, if I could, because
Certainly.
because I think that's a really important element of perhaps how we might support increased women's participation in peacekeeping. There are certainly challenges to training. Again, it's a lack of understanding by member states about the Security Council Resolution 1325 and also UN policy on gender equality in peace operations. There's also the prevalence of social norms and biases that perpetuate gender equality within the security sector, and this is quite common across militaries from developing to developed countries. There's pushback from men and women who see this as a women's issue, and that's been spoken of numerous times, rather than actually seeing it as an operational concept. And we in the military and police really should be viewing it in that way. There's also a lack of expertise in designing and delivering training, and also making sure that the right people get to training. So the senior leadership are probably the first people that we need to start with to actually have on courses that train them and get them to understand what gender perspective is all about. So there's some ways in which this can be achieved. We can examine best practice from other national institutions and peacekeeping centres. We can build gender training requirements into our national action plans or gender equality strategies. We can engage international staff to come and assist us, and I'm really delighted to say that hopefully we'll have some discussions between UN Women and the Women's Training Centre about potentially some training we can do for female personnel to enhance their opportunities for employment in security institutions. And we can also utilise training opportunities that are already available out there, for example, NATO courses that are online, as well as those available in the Nordic Centre for Gender in Military Operations. So there are plenty of other training opportunities out there that we should be looking to use their training to assist us in developing our own capacity.
Okay, thank you very much. I'd like to come back to the Mediterranean Women's Network. So this network was launched in Rome this past October. And I'm wondering if you can tell us where you're at with the network in terms of activities, and how and where you see the network engage, as well as potentially what you're doing in terms of CVE.
The Mediterranean Women Mediators Network, as you said, was launched at the end of October in Rome. This project is promoted by the Italian Ministry of Foreign Affairs within the framework of the Italian mandate at the Security Council this year. This was Italy joined the Security Council in January this year. It's going to finish its mandate at the end of this year because the Netherlands will take over for the coming year. And as part of the deliverable, there was supporting this initiative of establishing a network of women mediators within the Mediterranean. The idea is not new in the sense that there are already, in the last year, there was a proliferation of networks in this field. There are a couple of networks of women mediators in Africa. One is from the African Union, then there is WIIS. Another one was supported by Norway in the southern region of Africa, followed by the Nordic countries that established their own 2 years ago. So Italy, inspired by this initiative, decided to promote this network in a region that is very important for our country, with the aim of increasing the number of women mediators in order to build sustainable peace within this region. So we started the process at the beginning of last year. WIIS is implementing the project together with IAI, Institute for International Affairs. So this is the result of a joint collaboration between the government and civil society organization, which is also reflected within the composition of the network. We built a network that has a mix of governmental representatives and civil society experts. It's a very heterogeneous group of women and multi-generational, so the aim is really to cover all expertise within the region. We have experienced mediators, but we also have potential mediators. So of course one of the objectives is to train them, but try not to train for the sake of training, but really to see how then we can really involve them in some mediation process. But when we talk about mediation, we think as a country to look in a broader sense, not only as heading the mediation as track one at a political level, because if you think only at this, of course, then the role of women ends once you sign the peace contract. So what we think it's important that all the aspects are important, especially the prevention aspect and the preparation of a peace agreement and the implementation part. Because if you only push for having women as a mediator, which is extremely important, is one of the points, one of our objectives, but not the only one, you will then close women only on that position. And then the gender perspective and the women's role will finish. Whereas we know that it's very important that in the implementation aspect, women are present for supporting the implementation of the gender perspective, together with men, because as it was reiterated several times this morning, we cannot think that women will change this dynamic alone. We do need to work together. But then it's extremely important to have the gender perspective and women involved in peace negotiation, especially in the unofficial phase. We know that when a project and a peace process is designed, everything is already set when it starts. So if we don't include women in the preparation of it, in the informal dialogue, both at civil society level and the political level, once this process will start officially, it will be too late to have women involved and certain issues addressed. I wanted to stress that women have a lot to say, not only about women's issues. So it's sure that Gender Equality Commission are extremely important. We see this also in the Syrian process, we saw in the Colombian process, and the Filipino. But we have to support the inclusion of women within all the commissions, because women can talk about all aspects of the society on the peace and the reconstruction of the society. And this is to come to the question about the role of women in counter-violent terrorism. We didn't address this specifically. Now we didn't address at this stage the subject that we are going to work about. What we launched a network, it is established. We are discussing a lot about working methodologies, because we learned from previous experiences, the parallel networks, that this is very hard to run this kind of network. So an additional initiative supported by UN Women now, it will be a kind of network of networks, a coordination of them, where we will try to make synergies, not to overlap, but really to work together. So we are now assessing the conflict trends within our region, because the aim of our network is really to focus on the Mediterranean. Okay. But it's also to have women, as I said, involved in prevention. So, and this is the answer. Yes, of course, when you talk about prevention of conflict, women will have a role to play in CVE.
Okay, thank you. Speaking of the role of prevention, the United Nations in 2015 did 3 major reviews, and the key finding of most of those 3 reviews actually was the importance of the role of prevention. And I'm wondering, Daniel, if you could tell us a little bit about what you feel are some of the positive examples of where we're seeing this, and some of the challenges to taking that prevention agenda further in the context of those reports.
Yes, thank you. The problem with prevention is that you don't know when it succeeds. You don't notice it, because basically successful prevention, there's no conflict. So it's very difficult to prove that some specific prevention initiative actually succeeded or contributed to a conflict not happening. Now, particularly if we take a very narrow view of prevention, as in, you can see a conflict brewing, you take certain measures, and then the conflict never actually explodes. But there are not a lot of cases of that. But if you take a broader view of prevention, then it's not that difficult to think how this agenda actually contributes to preventing conflict. The more egalitarian societies, particularly gender-wise, are always the more peaceful. I don't think that's a coincidence at all. I think that it says something about a society, about how society inherently resolves conflict in peaceful ways when it can reach this kind of understanding. The societies that are more peaceful also tend to be security institutions that are more representative of the people that they serve, including in terms of gender balance, and they also tend to be accountable and transparent institutions that are able to hear, understand, and respond to the security priorities of the population. And I think those are the key, a little bit the key takeaways from this broader understanding of prevention. We at DCAF, we describe our own work within a prevention framework because it's not only responding to the security reform that happens after conflict, is ensuring that security institutions and security thinking always evolves at the same pace as the society that it serves. And one of, obviously, the most visible aspects of that is how the security institutions respond to the security priorities and understandings of men and women in the society. So in that sense, I think that you can see a lot of successes in using this gender perspective in security as a prevention tool, but you have to step back and look broad and wide to see them.
Thank you very much. Just in the context of looking after the needs of the security, the men and the women's needs, in society, I would like to turn attention to Dr. Aysha. Can you please tell us about your experience protecting women and helping gain participation in Kosovo and Afghanistan and in Yemen? I understand that you have had direct experience in each of those conflicts and have yourself facilitated the prevention agenda by helping the citizens in those countries access the things that they were themselves in need of and were asking for. So we would love to hear about your experiences, if you could share them with us.
Sure, it will be my pleasure, Leah. But let me start with saying that I do agree completely with my colleagues that it takes actually the right woman in the right place and also leadership. So having the leadership, the UAE leadership, supporting the participation of women, in particular Her Highness Sheikh Fatima bint Mubarak, saw the need actually for the UAE women to participate in Kosovo. This was back in 1999. And this was actually the first UAE participation within the NATO, umbrella. So this was completely, a complete international, experience, and the war was still going on. So, the women participation came when not during the peacekeeping, but before that, during the conflict. So it was, the participation, they started with the medical, as I said, and we are kind of privileged because we, medical is always needed. But through the participation of the medical teams, of the female medical teams, they saw that actually, the females are, more capable of communicating with the less fortunate. So it wasn't our, just providing medical care, through talking to the hospitalized and even going to the refugee camps. The UAE actually camp, there were around 15,000 refugees in the UAE camp. So we had the opportunity to go inside the camp as females. It was easier for us because most of the refugees were actually women and children and even the elderly. So we started actually communicating with them, and this is through that communication that we, the force there or the teams there realized that actually we do have something to add. We have we have different perspective. We do have other maybe methodologies or tools to actually give them some kind of solutions. Our ability to communicate as females, were actually easier. We can communicate with men, women, and all ages. It's easier for us, especially if it is within conservative communities. And it was that actually experience, and it wasn't also, I'll have to, I'll also give the credit to the medical teams that were with me. We're not only, treating, we participated in everything and, delivering the aids and communicating with the, when it is, sometimes it's difficult to start communication if you don't have a female. And we did have actually kind of communication also with the international organizations, working there. So it was that experience that encouraged the leadership again, to actually take another bold, decision to involve, the females, because they saw that actually one of the, one of the major tools or, things that they can do to kind of, go into a very dangerous province, which is Helmand province. This is a very conservative, community and the province that it's difficult if you don't have females to actually, infiltrate that community. And it was one of the most dangerous areas. But the only way was actually to involve females. And this was kind of also a kind of, mutual decision between the UAE and the US. So both countries started, sending, females. Again, we have the advantage as doctors to be able to go in easier than, maybe other professions. So this is what actually exactly happened, that, we started building, the clinics, polyclinics, and we started advertising that, to the community that, there are female doctors, female nurses, that they are going to actually be, treating, the females and the children. This was welcomed by the communities there because they were in need, but they did not really want to kind of, breach the tradition that they don't want a male to be treating their wives. So it was through that actually medical participation is that also I could myself I did sit in the first Shura or Majlis. The Shura Majlis is it's all the influential peoples can sit and actually make decisions, and those decisions are respected and people will follow those decisions. I was also honored that they actually took me as a role model. Since I'm a Muslim, I'm veiled, I'm here taking all the all the risks just to actually ease their lives. And it was also through their respect, to us as, medical teams, is that we could actually, speak, and they were kind of, started getting, having this trust in us to leave their, women, in the clinic. We started with, them bringing less of their women, having them for a short period, accompanied by a male, when you are examining, to leaving them alone. And this is where we started actually having the opportunity to, try to influence, their actually thinking, and, just try to empower them and tell them that, they are the key, because, they are the mother, the sister, the daughter. So it is actually the woman that, did raise, those maybe, let's say, radicalists, or people that they think, differently than the rest of the world. So, Taliban or ISIS or wherever, actually they were born, and they were brought and raised by women. So they have their, women in their lives. So I don't think that, excluding those and, will actually solve the problem. You really have to be able to, reach those women and try to actually make them part of the tool to change the mentality of those, and luckily most of the terrorists, let's say, they are not females, not yet. So, also based on that, experience in Afghanistan, that one actually highlighted the need to actually also again, allow the right females, when it is the right timing. Also, there is a right timing sometimes to actually be part of, bringing peace and prosperity to the place. So during the Yemen conflict back in 2015, the most needed was actually, the medical, and this is also where you can actually attract people and start, while, the political negotiations were taking place and going on, you need to do something on ground. And this is, where actually, so even though we have women, of course, at the political level, but also you need to have people, on ground. And this is where actually my role came in. We started, by approaching the communities and, seeing what is their, not only the medical need, but also educational needs. So we talked about not only medicine, but also we talked about, education and school and security, the infrastructure. So I was part of a bigger group that we tackled all those. And through this, they realized that, they are missing a lot. Then, we came, having me, part of that, let's say group or task force, encourage the Yemenis to actually, allow their females to participate in this process. I know that there are actually Yemeni ministers and females in the political, but this is also again made them or gave them a chance to actually allow their women and to participate. And actually also I'll have to give the credits for the females, in the Yemeni females or women, that they did a great job. They were there in the front lines, believe it or not. And that's why this is a big reason why we cannot just exclude them, because while they men were fighting, the women actually were just right behind them, treating them and alleviating the suffering and the pain from the people. So believe it or not, also most of the hospitals were actually run by females, not the so it was surprising, but it's that actually you can see them working day and night. So this, and I'm glad to say that through the years, since 2015 up until now, I can see from my visits that they are actually involving women more and more. Even when it comes to places where they are really very conservative, they are starting to see the need of women participation. Also, when you sit with women, they will give you ideas that maybe the men did not really think about, and this is where we actually convey those ideas. Actually we did have few ideas coming from women that we did not hear from the men when we were sitting with them. So I think my experience since 1999 up until now actually highlights that leadership is needed, the right woman, right timing, and involving women actually in the peacekeeping and security, not only at the operational level but also at the strategic level, is very crucial.
Thank you very much. I think that that's quite an extraordinary testimony to the UAE's leadership with the inclusion of these medical service teams and the multi-dynamic or multifunctional roles that they play. It sounds to me a little bit when you were speaking like female engagement teams, where they were able to get situational awareness, they were able to gain intelligence just by speaking to women and gain access to information that might not have otherwise been readily available, but also support the 4 pillars of the Women, Peace and Security agenda, which are of course the participation of women and the protection of them and the prevention as well. So that's really quite an extraordinary example of leadership. Thank you for sharing the story. Okay. Just in closing, I realize that this panel is between you and lunch, and I'm sure a lot of you are ready. So in closing, I just wanted to thank the panelists very much for their participation and invite you to make any additional comments if you would like to, either on the operational role, that operational tool that Women, Peace and Security holds, or as leaders and the contribution that women can make. If you had any final comments, I'd like to just open it up.
They look hungry.
Okay. So if there's no comments that you would like to make, what's about you, Aysha? Any final comments?
I think my final comment is that I'm glad that this is happening in the UAE, and I do believe that with the capabilities available in the region, that the UAE actually can be the lead in gender equality and the initiation of, or let's say maybe we don't have yet an action plan written, but I think the UAE started applying this without even the action plan. I wish all the best for everyone.
Indeed. Thank you very much. So without further ado, I would just like to thank my distinguished guests once again, and that concludes the panel for today. Thank you.